Certified Surgical Technologist, CST, practice test, sterilization, wound healing, sutures, and emergency situations.
Question 1. What is the primary purpose of the decontamination process in the Central Sterile Supply Department, CSSD? Option A. To organize instruments into sets. Option B. To physically remove bioburden, blood and tissue, and render items safe for handling. Option C. To completely kill all bacterial spores. Option D. To wrap instruments for storage.
The correct answer is option B. To physically remove bioburden, blood and tissue, and render items safe for handling. Decontamination is the physical and chemical process of removing bioburden from instruments, making them safe for personnel to handle prior to the actual sterilization process.
Question 2. What is the minimum temperature and time required for standard gravity displacement steam sterilization of a wrapped instrument set? Option A. 250 degrees Fahrenheit 121 degrees Celsius for 15 minutes. Option B. 270 degrees Fahrenheit 132 degrees Celsius for 3 minutes. Option C. 250 degrees Fahrenheit 121 degrees Celsius for 30 minutes. Option D. 270 degrees Fahrenheit 132 degrees Celsius for 4 minutes.
The correct answer is option C. 250 degrees Fahrenheit 121 degrees Celsius for 30 minutes. For a standard gravity displacement sterilizer, a wrapped instrument set must be exposed to 250 degrees Fahrenheit 121 degrees Celsius for a minimum of 30 minutes to ensure sterility.
Question 3. Which sterilization method is utilized for moisture-sensitive and heat-sensitive items, like flexible endoscopes and cameras, but requires a lengthy aeration process to remove toxic gas? Option A. Ethylene oxide, ETO. Option B. Pre-vacuum steam sterilization. Option C. Hydrogen peroxide plasma, STERID. Option D. Glyceraldehyde, Sidex.
The correct answer is option A. Ethylene oxide, ETO. Ethylene oxide is a highly toxic, flammable gas used to sterilize heat/moisture-sensitive items. Because it is toxic to humans, items must undergo a prolonged mechanical aeration phase before use.
Question 4. Bowie-Dick tests are used daily in the sterile processing department. What specifically does a Bowie-Dick test check for? Option A. The presence of live bacterial spores. Option B. The concentration of ethylene oxide gas. Option C. The complete removal of air and detection of air leaks in a dynamic air removal, pre-vacuum, steam sterilizer. Option D. The moisture content of the steam.
The correct answer is option C. The complete removal of air and detection of air leaks in a dynamic air removal, pre-vacuum, steam sterilizer. The Bowie-Dick test, a type 2 chemical indicator, is run empty every morning in pre-vacuum steam sterilizers to ensure that the vacuum pump has effectively sucked all the air out of the chamber.
Question 5. What is the standard immersion time required to achieve high-level disinfection of an endoscope using 2% glyceraldehyde, Sidex? Option A. 5 minutes. Option B. 20 minutes. Option C. 10 hours. Option D. 24 hours.
The correct answer is option B. 20 minutes. High-level disinfection destroys all microorganisms except high numbers of bacterial spores. Submerging a clean, dry item in 2% glyceraldehyde for 20 minutes to 45 minutes achieves high-level disinfection.
Question 6. Which of the following is considered an absorbable, synthetic, monofilament suture commonly used for closing the fascia or subcuticular skin layer? Option A. Polydioxanone, PDS2. Option B. Silk. Option C. Polypropylene, Proline. Option D. Chromic gut.
The correct answer is option A. Polydioxanone, PDS2. Polydioxanone, PDS, is a synthetic, monofilament suture that absorbs slowly over 90 to 180 days, making it ideal for tissues that heal slowly, like fascia. Proline and silk are non-absorbable.
Question 7. According to the United States Pharmacopoeia, USP, sizing for suture materials, which of the following suture sizes has the smallest diameter? Option A. Number 1. Option B. 2 to 0. Option C is 0. Option D. 4 to 0.
The correct answer is option D. 4 to 0. Suture size decreases as the number of zeros increases. Therefore, a 4 to 0, 0, 0, 0, 0 suture is significantly thinner and smaller than a 2 to 0, 0, or number 1 suture.
Question 8. When passing a needle holder and suture to the surgeon, how should the needle be positioned in the jaws of the needle holder? Option A. Clamped precisely at the swagged end, where the suture attaches to the needle. Option B. Clamped in the exact middle of the needle. Option C. Clamped approximately 1/3 of the distance from the swagged end to the needle point. Option D. Clamped at the very tip, point of the needle?
The correct answer is option C. Clamped approximately 1/3 of the distance from the swagged end to the needle point. To prevent the needle from bending or breaking, and to prevent damaging the swagged end, the needle holder should grasp the needle about 1/3 of the way down from the swagged, eyeless, end.
Question 9. Which of the following surgical needles is specifically designed with a blunt point to safely pass through highly vascular, friable, easily torn organs like the liver or kidney? Option A, taper point needle. Option B, conventional cutting needle. Option C, reverse cutting needle. Option D, blunt point needle.
The correct answer is option D, blunt point needle. Blunt point needles literally push tissue aside rather than slicing it. They are used specifically on soft, friable organs like the liver, spleen, and kidneys to prevent severe bleeding.
Question 10. Which class of surgical wound includes a planned surgical opening of the respiratory, alimentary, or genitourinary tract under controlled conditions without major spillage? Option A, Class 1, clean. Option B, Class 2, clean contaminated. Option C, Class 3, contaminated. Option D, Class 4, dirty/infected.
The correct answer is option B, Class 2, clean contaminated. A Class 2, clean contaminated, wound involves controlled entry into a hollow organ containing endogenous flora, like the bowel or trachea, without massive spillage or existing infection.
Question 11. Which phase of wound healing involves the rapid proliferation of fibroblasts, the formation of new capillary networks, angiogenesis, and the creation of red, beefy granulation tissue? Option A, inflammatory phase. Option B, proliferation phase. Option C, remodeling/maturation phase. Option D, hemostasis phase.
The correct answer is option B, proliferation phase. The proliferation phase, days 3 to 24, is characterized by the formation of granulation tissue, collagen synthesis by fibroblasts, and wound contraction.
Question 12. What is the medical term for the partial or total separation of the layers of a surgical wound after closure? Option A, evisceration. Option B, dehiscence. Option C, fistula. Option D, herniation.
The correct answer is option B, dehiscence. Dehiscence is the splitting open or separation of a surgical wound. Evisceration is a severe form of dehiscence where the internal organs actually protrude through the open wound.
Question 13. During a massive hemorrhage in the OR, the anesthesia provider requests O-negative blood. Why is O-negative considered the universal donor? Option A. It contains both A and B antigens. Option B. It lacks the Rh factor but contains A antigens. Option C. It lacks A antigens, B antigens, and the Rh factor. Option D. It has the highest hemoglobin concentration.
The correct answer is option C. It lacks A antigens, B antigens, and the Rh factor. Type O negative blood lacks all three major antigens on the surface of the red blood cells. Therefore, it will not trigger a severe immune/hemolytic reaction when transfused into a patient with any other blood type.
Question 14. Which of the following is a classic, early clinical sign of a patient experiencing anaphylactic shock during surgery? Profound bradycardia, severe hypotension, hypertension, and bronchospasm. Option A, pale. Option B, cold. Option C, clammy skin. Option D, hypothermia.
The correct answer is option B, cold. Anaphylaxis is a severe systemic allergic reaction. Early signs under anesthesia include a sudden drop in blood pressure, hypotension, tachycardia, and difficulty ventilating the patient due to bronchospasm.
Question 15. During a cardiac arrest in the OR, what is the primary role of the scrub surgical technologist? To break scrub and perform chest compressions, to leave the room and call a code blue. Option A, to remain completely sterile. Option B, protect the sterile field. Option C, and prepare the internal defibrillator paddles or necessary syringes if the chest is open. Option D, to administer 4-epinephrine.
The correct answer is option C, and prepare the internal defibrillator paddles or necessary syringes if the chest is open. The surgical technologist must protect the sterile field from contamination during the chaos of a code. If the patient's chest is open, the tech must immediately prepare syringes of warm saline, epinephrine, and internal defibrillator paddles.
Question 16. What is the primary purpose of applying a bulky pressure dressing to a surgical wound postoperatively? To keep the wound completely dry, to eliminate dead space. Option A, prevent edema. Option B, and minimize hematoma formation. Option C, to make the patient feel more comfortable. Option D, to prevent the patient from looking at the incision.
The correct answer is option B, and minimize hematoma formation. Pressure dressings are applied tightly over a wound to compress the tissue, eliminate empty dead space, prevent the pooling of blood, hematoma/seroma, and restrict excessive swelling.
Question 17. A Penrose drain is placed into a wound bed. How does a Penrose drain function to remove fluid? By active. Option A. Closed wound suction. Option B. By motorized negative pressure. Option C. By passive capillary action and gravity. Option D. By attaching to wall suction.
The correct answer is option C, by passive capillary action and gravity. A Penrose drain is a soft, flat latex tube. It is a passive drain. It relies solely on gravity and capillary action to allow fluid to wick outward from the wound onto a dressing.
Question 18. Which of the following tissue types heals most slowly due to an incredibly poor blood supply? Option A. Muscle. Option B. Mucous membranes. Option C. Epithelial tissue. Option D. Cartilage.
The correct answer is option D, cartilage. Cartilage is avascular, lacks a direct blood supply. Therefore, nutrients and oxygen must diffuse through surrounding tissues, making it one of the slowest healing tissues in the human body.
Question 19. During an abdominal case, the surgeon requests a stick tie. What is the surgeon asking for? A free piece of suture with no needle. Option A. A suture swagged onto a needle. Option B. Clamped onto a needle holder. Option C. A metal surgical clip. Option D. A monopolar Bovie pencil.
The correct answer is option B, clamped onto a needle holder. A stick tie or suture ligature is a strand of suture attached to a needle, loaded onto a needle holder. It is used to pass through and securely tie off a large, bleeding blood vessel.
Question 20. What type of stapler simultaneously places two double, staggered rows of titanium staples and cuts the tissue between the rows? Option A. TA, thoracoabdominal, stapler. Option B. LDS, ligating and dividing, stapler. Option C. GIA, gastrointestinal anastomosis, stapler. Option D. EEA, end-to-end anastomosis, stapler.
The correct answer is option C, GIA, gastrointestinal anastomosis, stapler. The linear cutter, or GIA stapler, fires two parallel rows of staples on each side and utilizes a knife blade to cut the tissue right down the middle. It is heavily used in bowel resections.
Question 21. When an unwrapped, non-porous stainless steel instrument is flashed, immediate use steam sterilization, in a gravity displacement sterilizer, what is the required temperature and time? Option A. 270 degrees Fahrenheit 132 degrees Celsius for 3 minutes. Option B. 250 degrees Fahrenheit 121 degrees Celsius for 10 minutes. Option C. 270 degrees Fahrenheit 132 degrees Celsius for 10 minutes. Option D. 275 degrees Fahrenheit 135 degrees Celsius for 15 minutes.
The correct answer is option A, 270 degrees Fahrenheit 132 degrees Celsius for 3 minutes. For a single, non-porous metal instrument with no lumens, like a dropped hemostat, the required flash cycle in a gravity sterilizer is 270 degrees Fahrenheit for a minimum of 3 minutes.
Question 22. What biological phenomenon causes Creutzfeldt-Jakob disease, CJD, which requires extremely highly specialized decontamination protocols? A highly resistant gram-negative bacteria. Option A. A mutating virus. Option B. A mutated. Option C. Misfolded protein called a prion. Option D. A systemic fungal infection.
The correct answer is option C, misfolded protein called a prion. CJD is caused by prion, which are highly resistant to standard chemical and heat sterilization. Instruments exposed to CJD require specialized, extended steam sterilization or complete incineration.
Question 23. Which of the following is a key characteristic of healing by second intention, granulation? Option A. The wound is sutured closed immediately after surgery. Option B. The wound is left open to heal from the inside out. Option C. The wound heals with almost no scar formation. Option D. The wound is closed with surgical staples.
The correct answer is option B. The wound is left open to heal from the inside out. In second intention healing, the wound is intentionally left open, often due to heavy contamination/infection. It heals slowly from the bottom up via the formation of granulation tissue and contraction.
Question 24. During a surgical procedure, what is the safest and most standard method for passing a fresh scalpel to the surgeon? Option A. Passing it hand to hand with the blade pointed down. Option B. Placing the scalpel in a designated, neutral zone, like a kidney basin or a magnetic mat. Option C. Tossing it onto the sterile drape near the surgeon. Option D. Passing it behind the surgeon's back.
The correct answer is option B, placing the scalpel in a designated neutral zone like a kidney basin or a magnetic mat. The neutral zone or hands-free technique significantly reduces the risk of sharps injuries. The tech places the sharp in a designated basin or mat, and the surgeon picks it up, avoiding hand-to-hand passing.
Question 25. Ultimately, what is the primary ethical and professional mantra of the Certified Surgical Technologist regarding patient safety? Aegis Mando, I protect. Option A, primum non nocere, first. Option B, do no harm. Option C, asepsis semper, always sterile. Option D, Eger primo, the patient first.
The correct answer is option D, Eger primo, the patient first. Eger primo, meaning the patient first, is the guiding motto of the Association of Surgical Technologists, AST, reflecting the surgical technologist's ultimate dedication to patient care and safety.